We're going to talk today about handling and cooperative care and this very specific question that people have, which is while I'm working on cooperative care procedures and my dog's participating in their care, what do we do when we need to get things done? Like when we need to trim their nails or we need to give them a bath. And I'm going to expand more on what this means in a minute. And if this resonates with you, hang around. My name is Karishma War, if you haven't met me. I'm head of training at CCA, and we work with sensitive dogs and their exceptional guardians all over the world, helping them live peaceful lives, helping them heal together. And, oh, Jodie, my hair looks amazing. Thank you. I'm growing it out. Don't compliment me, guys. I'll get distracted. Let's talk about the challenge a little bit here, because I think I need to expand on it a little bit more. So we want to, at all times, provide our dogs with as much choice, as much agency as possible, because we know in many ways that's really beneficial to them. And this has trickled down into care procedures like brushing, bathing, grooming, nail care, vet care. And the idea is that more and more guardians are working on participation from their dogs in their care. So we might teach our dogs to, offer a paw for a nail trim, or, like opt in for a bath, jump in the bath themselves, those sorts of things. And those things are amazing. I love that stuff, obviously, for obvious reasons. But we do sometimes find the broad use of this as a cure-all for every behavior challenge around handling is often not necessarily always going to be helpful. And I see a lot of clients who have tried to do cooperative care with their dogs, and actually it's made things a little bit worse. And I want to talk through what might be going on there. So a lot of dogs that I work with, they're not like, young puppies or, just your average adolescent. We're working with very sensitive dogs who have very big feelings. So if your dogs struggle with sounds, people, dogs, places, travel, if they're generally high strung, anxious, you're in the right place. That's exactly our sweet spot at CCA. And the dogs we work with often struggle with multiple of those different things at once. We're talking about dogs who have quite extreme behavior challenges here. And so it's not really a surprise that the average cookie cutter kind of advice might not always work as well. Unfortunately, sometimes I see it not just that it doesn't work, it can actually do some harm. And I kind of identified with my community this spiral that people get in where they're trying to do things cooperatively, so they hold off doing care procedures like nails or cleaning. Then sometimes the dogs end up either in an emergency situation, like Hira stepped on bubble gum the other day, or rolled in poop, or, their nails have got so long that they've cracked a nail, or there's mats now, and it's a medical situation, there's an ear infection now, we need to do something. In doing that necessary care, our dogs experience behavior injury because they weren't prepared. We were working on that, but we weren't ready yet. And that behavior injury makes them even more reluctant, more aggressive, more defensive, more fearful of that handling procedure. And then we're back at the beginning again, trying to build cooperative care. And I want to know if that resonates with anyone, with my own boy, Hira, who's on the floor over there. You can see him over there. There he is. We were in a very similar situation. So he's a poodle, so he has a nightmare coat. And then he also has some structural issues that cause ear infections and skin infections because of some GI sensitivities. And so we were in this cycle of I was trying to build positive associations with the brush, with the hairdryer, with the bath, with the nail clippers. But then he'd get an ear infection and I would have to go to the vet, would have to give him the ear drops every day. And it just decimated our relationship. And this spiral continued. We were going down, 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 where he wasn't trusting me. He wasn't taking food from me anymore. He became picky about food. He became suspicious around me, didn't want to hang out with me, didn't want to be near me because he was worried about this. And I was talking to my community because we had so many people in the community telling me that this was a problem for them. So much so that I think it was last month, February was Happy Handling Month in the membership, where I made a 2-hour mini course for them all about this problem, which then developed into a 6-week program, which this happens too frequently. But so when I tell you that I'm just going to give you the beginning here, just know that there's a lot of information on this topic. But the general problem that we're identifying is that a lot of these dogs it's going to take a really long time to get this done cooperatively, or they're not appropriate dogs to ask for them to participate in the care, or the care is not appropriate to ask them to participate. Some examples. Hira has arthritis and he has a partial tear in his back right knee. It would be inappropriate for many people. I think I could argue that it would be inappropriate for me to ask him to participate in like joint mobilizing things that might hurt him. You know, you can't ask dogs to opt into things that hurt them if they are actively painful and chronically painful and dealing with pain on a daily basis. I know that we see all of these videos of like the lion accepting the jugular blood draw. So I'm not saying that we can't do it. We absolutely can in ideal circumstances. But a lot of our clients, we're dealing with dogs who were former free living dogs for years of their life. And now we're going to ask them to do a voluntary blood draw, or we're going to ask them to voluntarily offer their, injured paw. So maybe the procedure is painful, maybe the dog is painful, maybe the procedure is just way too hard for this particular dog, right? So if we have a dog who's terrified of people, asking them to, do a chin rest in a vet clinic might be a really unreasonable goal for that particular dog. If that dog has a long history of trauma, it might be a really unrealistic goal. And so what I do in the mini course, in the membership, is I really break down, when it comes to participation, there are pros and cons, right? So there are some things that we really want to build participation with, and it has loads of benefits. But there are also some cons to participation. And when it's done incorrectly, there can be really big fallouts. So I made these mistakes with Hira, where I really tried using food, using training, using toys to get him to love every procedure. I wanted him to, offer his hair to be brushed. I wanted him to give me his paw to do his nails. I didn't really realize that at the time he was dealing with chronic pain that I didn't know about. He was also chronically stressed. Ooh, that was fun. He was also chronically stressed. And so when I was using the highest value food to lure him into the bath or to get him to eat while I was brushing him, I was actually coercing him into doing these things. I was disrupting our relationship. And what it ended up with him was, at the beginning, he would take food really hard. He would sneeze. He would get angry. And then eventually he ended up biting me mid-chew. And then eventually he stopped eating. He stopped doing training sessions with me in the house. Food stopped being reinforcing. I stopped being a safe place, because every now and then I would just hurt him. And then I tried to trick him and coerce him into participating because I thought that was the right thing to do. And I don't blame myself. Of course, this is what I was told to do. I really thought I was doing the right thing. Oh my God, he's doing that thing where he's twitching in his sleep. Ugh. But, poodles, man. Poodles are really not easy dogs to take care of. I can literally show you guys. I'll turn my camera around. You can see these are some of the slides from the mini course. Look at that. That's what he used to look like. If you guys have seen Hira, you'll know that he does not look like that anymore. Poodles require, sometimes it can take, 4 hours, 5 hours to do a full poodle groom. What's he meant to be? Participating and getting cookies and negotiating for cookies the whole time? I was trying to do that, and you can imagine he did not enjoy it at all. Okay, now he's growling in his sleep. It's so cute. Oh, I woke him up. Whoops. Sorry, buddy. So hopefully you guys are seeing the problem that we might be in here, the kind of doom spiral that I discussed, how if we try to do participative care, we try to get them to cooperate with us in inappropriate moments, we can actually really fuck things up. And I don't have much time to go into this. Like I said, I have a 2-hour mini course in my membership, and I have a 6-week program that I'll talk to you about at the end a little bit more. But what I'm going to talk about today is the kind of 3 big points that kind of really stick out to me about how we get around this problem. And like I said, a 6-week program all about this. So please do not reduce it down to just this. And please come and learn more, at least in the membership, if you want to. Okay, so number one, the first thing that I'm going to be teaching you guys in depth in the mini course and in the membership is the difference between participation and harm reduction. Okay, so we can have participative care. Does that make sense? I don't know. Now, care that the dog participates in. That's usually with food, sometimes toys, and there's like a conversation that's happening where they are getting food, and often there's an element of them like opting in. Participation is something that we teach for lots of dogs in lots of contexts. There's actually loads of courses about teaching participation and cooperative care. What I am an expert in at this point, working with thousands of really, really sensitive and unwell dogs, is harm reduction strategies for necessary care procedures. When a dog is not ready to be participating, when asking them to participate could actually damage the relationship and the learning history that they have with the food and all of that, we have to look to what else can we do? How do we shift the goalposts from having them opt in and participate to protecting the future comfort of the dog? We want to get it done, and we want the dog to not be traumatized, to not have a behavior injury as a result. And so I'm not going to go into different harm reduction strategies in too much depth. I'm going to send you guys to the mini course for that. And the first 2 weeks in the membership are free, so you can literally go and watch it for free right now. But I go into depth about different harm reduction strategies that we use to take a dog from being unable to have this procedure done to actually being able to tolerate it. So for Hero, for example, nails, grooming, vet visits, any of those things would cause him at the beginning weeks. He'd be stressed. He'd be recovering for weeks. Our relationship would be damaged for days and almost a week, Through harm reduction strategies, I was able to get it that I could do basic care, get it done, and he would recover the next day. And there's a huge list of things here, so I'm going to send you to the mini course at least to learn a little bit more about that. But I want to just get you guys to understand the difference. There's a difference between getting the dogs to opt in and saying, how can we get this done in a way that's going to be minimally aversive? And often it's like a lot of different interventions that we put in place. So go to the mini course there to learn a little bit more. I'm going to talk about the second point here. We first of all develop harm reduction strategies that we can use with your dogs. And so in Happy Handling, the 6-week course, every week I give you guys a set of necessary care task to do, usually the same one every week. So I had a dog working on nail trims every week. And the first few weeks we worked on the back feet, and then we worked on the front feet, and now we're doing teeth brushing. Like, you can see how we progress through the weeks. Every week we get one practice shot with the harm reduction strategies, and we build over time more comfort with with the procedures that way. Because we are not going to be doing it perfectly with cooperative care, the second most important thing to think about is that you need a foundation of secure attachment. We are sometimes going to have to do things that they don't love. Sometimes I'm going to have to give you the injection. I'm going to have to cut that mat out. I'm going to have to brush your teeth. You might not love that. You might not opt in, but you can handle it. We can recover. And that only happens on a foundation of secure attachment. And I have a whole module in Happy Handling, the course, the 6-week course, about secure attachment, what it means, what are some of the things that commonly rupture attachment with these dogs. Spoiler alert, we talk a lot about how much we touch them mindlessly. We talk a lot about, the little ways that we can be chipping away at our attachment. And then we talk about ways we can invest in the attachment, ways we can build attachment. And it's a big part of our program because unless we have this foundation, this well of attachment that is secure and solid, when we do need to do necessary care procedures, even if we make them as reduced of harm as possible, even if we're as amazing as we can be in that area, we still need to be able to bounce back. And it's this delicate balance of sometimes we have to kind of withdraw and then we have to deposit and invest in that relationship. And it's very different to just trying to build up the dog to participate over weeks and months. It's a different strategy, but we actually see that through this combination of harm reduction and this secure attachment piece, we actually see dogs getting more comfortable with the care procedures without actually any food, really. No, we're not like giving them cookies after we brush them. Like it's not like brush cookie or licking in the bath. The dogs get more comfortable because of the clarity, the kindness, because I can coach you guys in how to, when to touch them, when to not touch them, for example. So part of the harm reduction strategies involve, what do we do when they pull away? What do we do when they try to get their leg out of our hands? And I go back and forth in the last program. I've been going back and forth with clients. They've been sending me videos of their dogs, having a moment where they're a little bit panicking or they're starting to think, I'm not into this. And we're working helping them work through those moments in a really kind way. I want to be really clear. When I say that we are not doing participative care, I don't mean we're holding the dog down and the dog's screaming. Again, we are doing this in a way where there is no behavior fallout. And we check every time we do a necessary care procedure, we check the data. We look at how the dog's responding, how the dog is around you, how is the dog near where they were groomed or where their nails were cut, how are they with food? And we make sure that we're able to perform these necessary care procedures without fallout. This is actually a real art form to do. And my third and final piece here is that this has to be done with a holistic wellness approach. You can't just come in and whap a few harm reduction strategies in and, hope for the best. We need to have a full holistic framework that we work with. And at CCA, we work with the HEAL framework, which I developed. We have a whole webinar on that in the membership as well. So if you want to sign up, you can just read the caption. You can sign up to the membership, 2 weeks for free. You can watch the handling mini course and you can ask me questions in the membership if you have any. And then you can watch the HEAL webinar too, because that's really good. And the HEAL framework is basically this 4-step framework that we have at CCA, and it takes us through all the different factors that impact behavior, of which there are many. And real quick list within the Happy Handling course, for example, I am looking at your dog's physical health, chronic pain, anxiety, stress levels, their routine, exercise, sleep, diet, social life, how much they rehearse natural behaviors, how diverse their behaviors are. There's a lot that we're looking at. It's not just about tackling this one particular problem. And we also have to look at the other behavior challenges that your dog exhibits, to treat them as a full picture. You have to kind of look at the whole dog. Whew, my God, guys. So today we were talking about this challenge that lots of people experience where while they're trying to work on cooperative care, they're struggling to get what they need to get done with their dogs. And we talked about how cooperative care is amazing. Sometimes, though, it might not be appropriate. And when applied inappropriately, it can actually do harm. And I talked a little bit about my experiences with Hera, mistakes that I made. And, this is just such a big problem with the community. It's literally made me think about this problem so much recently, to the point that I've made this 2-hour mini course in the membership and now a 6-week virtual program. Now the program, I have my first round is just finishing and I start a new round next week. So if anyone is interested, you can always DM me and let me know. The program is called Happy Handling, and you can read the caption to sign up for the membership, where you can learn more about harm reduction versus participation, the different tenets of harm reduction, and you learn a lot about, how I applied that to my dog Hera. You'll learn more about the secure attachment piece as well, and you can learn about the HEAL framework and how to bring a wellness approach to your dogs or the cases that you're working on, whether you're a guardian or a dog trainer. Yeah. Okay. Thank you, everybody. I'm going to finish up. Nice to see you all, and have a good day. Bye.